Good evening and welcome to Concord Hospital's Community Town Meeting. My name is Lori Story-Manso and I'll be facilitating the meeting this evening. With me are leaders from Concord Hospital and Riverbend Community Mental Health. Additionally, we have Kelly Griffin present as our chat host. If you have any technical questions or issues during the meeting, we invite you to type those into the chat box and she will be happy to assist you. Before we begin the meeting, I want to make you aware of a few technical considerations for this evening's meeting. First, we are recording the meeting. We will make the slides and recording available for viewing on Concord Hospital's website after the meeting. Second, please take a second now to locate the Zoom chat function on your screen. Feel free to say hello to the other attendees on this evening's call. When you do, please use the drop-down menu to select all panelists and attendees so everyone participating in the meeting will see your communication. Third, after a brief presentation, our panelists will answer your questions. We invite you to put your questions into the chat at any time, and we will answer as many as possible after the presentation. Fourth, while questions are being answered, you will also have opportunities to answer poll questions and they will appear on your screen. We're very interested in your opinions. And finally, we're grateful for your interest and participation in this town hall. So let's get started and let me begin by introducing Robert Steigmeyer, CEO of Concord Hospital. Bob, will you begin the presentation?
Sure, thank you so much, Lori. I want to first welcome and thank members of the Concord community and other guests for joining us this evening. The purpose this evening on our virtual town hall is to seek your feedback on the LRGH transaction that's been proposed and to answer questions. With me, joining me this evening are a number of leaders here at Concord Hospital. Dr. Matthew Gibb is our Chief Clinical Officer. Mr. Scott Sloan is our Chief Financial Officer. And Lisa Madden serves in a dual role, both as our Vice President of Behavioral Health and Riverbend Community Mental Health President and CEO. So they'll all join us here for questions in just a moment. Next slide, please. So let's start with what's happening. And by now, I think you're all aware that LRGHealthcare has filed for bankruptcy protection in the federal courts last week. And simultaneous with that, Concord Hospital and LRGHealthcare entered into a purchase agreement for the facilities, Lakes Region General Hospital, Franklin Hospital, and the hospital's ambulatory sites. And we are now conducting community and stakeholder meetings to solicit feedback and answer questions. This session is one of a number of sessions we're having. We've had them with our employees, our medical staff, other stakeholders, and now the community. We'll be submitting the proposed transaction to regulatory bodies. That includes the Federal Bankruptcy Court, as well as the State of New Hampshire's Attorney General's Office for their review as well. The bankruptcy process that we'll be proceeding with will include an opportunity for other bidders to step forward. And if indeed there are multiple bidders, there will be a physical auction. And so that's an important point to note. Next slide, please. So our goals. Let me say first that we have been working for quite some time on how to ensure that healthcare does not collapse in the region of the Three Rivers and Lakes regions. And so we've been paying attention to this for some time and working it through. And I want to emphasize the main reason we are where we are today can be summed up in one word, and that's mission. Our board and our management recognize that we've been serving patients in the Three Rivers and Lakes regions for decades. These communities are communities that mean something to our board, to our mission, and we're all aligned on serving them. Our mission states that we exist to meet the needs, the healthcare needs of individuals within the communities we serve. And the important point is these communities are communities we've served for decades. Very important piece. We want to build upon the quality of care that has existed in both regions for decades. In fact, LRGHealthcare has a 125-year history of serving the region. And here in Concord, we have over a 70-year history of serving the region. We want to reflect and strengthen our not-for-profit missions. We believe we have similar genetics in that we are both charitable nonprofit healthcare organizations in the pursuit of healthcare excellence. We will be assessing the needs in the Lakes and Three Rivers regions as we move forward, and we will make changes in the clinical scope to respond to those needs. We're very diligent about assessing population health need in a regular fashion. We seek to stabilize and create sustainability for the Lakes and Capital regions. We really do believe in local care, sustainably delivered, and that's what we're striving for. Next slide, please. We have a long history of collaborating with each other. If you look at cancer services and cardiac services, we've been working together for over 2 decades. And more recently with maternity, women's health, and vascular services as well. So we have had a long history meeting the needs in the region, largely what you might call advanced care needs. And so we've been partnering to serve the region for decades. Next slide, please. So what happens next? We'll be providing the feedback we receive from this session as well as others to the New Hampshire Attorney General's office. And ultimately, the U.S. Bankruptcy Court will make a determination on the purchase agreement. And then the New Hampshire Attorney General's office will make a determination regarding the proposed transaction. More specifically, there are 2 divisions within the New Hampshire Attorney General's office that will be important. One with regard to antitrust, and the antitrust division will review the transaction. And then the charitable assets division of the New Hampshire Attorney General's office will also review the transaction. So we'll work with those entities should we prevail in a auction process. Next slide, please. So if we're the successful bidder, we will indeed acquire Lakes Region General Hospital and Franklin Hospital and the hospital's ambulatory sites. The way we think about what we do next is very much in an incremental fashion. We obviously, given the state of the pandemic and the COVID situation, we will shore up what we need to shore up urgently, and we would do that right away. And then we would continue to assess the needs of the population, and we would configure the clinical scope of services both in Laconia and Franklin to meet those needs. So we wouldn't envision, other than shoring up services that might need to be shored up, we wouldn't envision any major changes till we get further into it and understand needs, and from there evolve the clinical scope. Hospital leadership will work together to determine that, and obviously we will be creating a central New Hampshire healthcare system with common practices for delivery and enhanced access to care. As I said, we believe strongly in sustainable care locally delivered. And that's a significant point of focus for us. Next slide, please. So with that, Lori, I'll turn it back to you to field questions for us.
Thank you, Bob. All right, so now's the opportunity to ask a question or share your opinion. We're very interested in what you have to say. So look for the chat button at the bottom of the screen, click on the chat and type the question or share your opinion in the chat box. At my discretion, similar questions and opinions from participants may be combined into one, and that's really to utilize our time as best we can. Feel free to ask more than one question, but if you do so, please type the questions one at a time. Bob, I'll start with the first question, and that is, how long is this process likely to take?
Yeah, very important question. So remember that we have a federal bankruptcy process, and then we have multiple state regulatory processes. And we were fortunate early on in talking with the state of New Hampshire, given the fragile nature of the situation, to ask if they could work with us to simultaneously do that work versus sequentially do that work. So while we're moving into a federal bankruptcy process, we're simultaneously working with the state of New Hampshire for the regulatory approvals. All of that said, we are anticipating somewhere on the order of a 6-month process, give or take.
Thank
Thank you,
you.
Lauren.
Will redundant services be merged?
Well, we will certainly be looking at services and what we would call value streams and service areas as a singular service provided in multiple geographies. But I would stress that I would ask for your patience in that it's going to take time to get through the bankruptcy process and the regulatory process, and then for all of us to lean in and configure the clinical scope as necessary. So I know I've received a lot of questions about what exactly is going to be delivered in these locations, and unfortunately, I would ask for your patience as we have to work the process to get to ultimately what we're going to do in these locations clinically. So the idea would be if indeed we have a service line or a value stream, what we call a value stream at Concord Hospital, we would seek to organize that in a similar fashion across the central New Hampshire geography.
What is the expectation for the LRG healthcare debt?
So this is important to recognize because Scott Sloan and I have been looking at the balance sheet of Lakes for now probably a couple of years, Scott. And what jumps off the page is the amount of debt that they have, and you've certainly seen that in the media. Early on, Lakes sought a buyer, and that process failed, and we think largely because of the amount of debt they hold. We suggested to them that if indeed they entertained a bankruptcy process, that we would be interested in talking with them, because we here at Concord can't compromise our financial position and strength by taking on that amount of debt. So the fact that they chose a Chapter 11 bankruptcy allows them to allows the debt to be eliminated and for us to receive on the other side the assets and to then build a central New Hampshire healthcare system. So the long story short is we wouldn't be responsible for that debt. That would be discharged in a bankruptcy process.
Okay. Along those same lines, how does Concord Hospital handle the costs of LRGH healthcare, and does it endanger Concord Hospital's viability?
Yeah, and maybe what I'll do, Scott, is I'll turn to you to sort of opine on that question.
Sure. Thanks, Bob. As Bob said, we've been looking at the finances of LRG Healthcare for 2+ years, and frankly, we wouldn't be having this discussion if we thought moving forward with acquiring their assets would put Concord Hospital's viability in question. We're very confident, despite the fact that they've been troubled financially for at least the last decade, that the extinguishment of the debt, solving one of their other major expenses, which is their IT system, which we can extend our system much more cost effectively, and then deal with just some other various contract issues that they've had. It's not easy work and it'll take time, but we are confident that that system can be a sustainable system and it will not put Concord Hospital's viability at risk.
Thank you, Scott. I would just echo that we have done exhaustive work around this. And as Scott said, we would not be having this session had we not convinced ourselves and our boards that indeed we can do it. And we feel confident with what we know, more than a year into diligence, that yes, indeed, we can make this work.
Thank you. Are you anticipating other bidders?
It's all speculative at this point. I always get the question, and we can all speculate together on that. I think the COVID situation and the pandemic has been trying on the country, and certainly in New England and certainly in New Hampshire. And so we're in a little bit of a different time now, given that we're kind of still in a worldwide pandemic. And that pandemic has stressed all healthcare providers to a significant degree. And so that may or may not influence a bidder, but certainly it's a challenging time from that perspective for a lot of folks, a lot of systems across the country. So we'll just have to see. We'll just have to see what comes.
Thank you, Bob. Okay. What do you anticipate the impact to be on mental health services in the community?
Yeah, and I'm gonna ask Lisa to make a comment, but I'll just tee it up in this way. We have been, I believe, a leader in the state of New Hampshire with regard to behavioral health services, and more specifically, behavioral health innovations. And so we have been the first in the state to stand up mobile crisis, the first in the state to stand up a crisis treatment center for urgent care for those in behavioral crisis. And and it goes on from there. So we don't intend to stop innovating around behavioral health. We intend to lean in and continue to make the investments necessary to meet that very important population health need. I hope Lisa, I didn't steal all your thunder.
No, I think that's fantastic and a wonderful thing to hear. And I agree. Concord has done a phenomenal job being an innovator and a leader for the state in behavioral health services. And, for people living with mental illness and addictions, there's been a real effort to fine tune the services that are available in this community, inclusive of the mobile crisis, of the crisis treatment center. We are one of the hubs for the doorway for substance use disorder access. And what we have done over many years is work very collaboratively with our colleagues in the Lakes region, and we'll continue to do that. We hope that if all goes as we hope it does for Concord, that we can strengthen that alliance and strengthen our continuum of care and be able to further streamline access to services. So we see this as a great opportunity to be able to strengthen behavioral health care for our region.
Thanks, Lisa.
Thank you. Since the two institutions use the same electronic health record, do you think that will be a benefit in the eyes of the bankruptcy court?
Well, I'm not sure from the eyes of a federal bankruptcy judge, but I can tell you that we believe, as Scott noted, that we can extend our Cerner installation to LRGHealthcare and do so at a lower cost and provide a better system setup. The fact that they're on Cerner and we're on Cerner, believe it or not, doesn't mean they're the similar installations. They're actually different and they function differently. And so our plan would be to extend our single instance and bring LRGHealthcare into our instance and do so at a much lower cost, and we believe a better system setup. So I believe that's clearly a benefit to us, and I would assume maybe a bankruptcy judge may see it as well as a benefit.
Thank you, Bob. What will the governance structure look like, and what's your timeline?
So the governance structure is a great question. What we're working on is the idea of single health system, single parent governing board. And so we see in the state a lot of different governance structures, but we personally believe the best structure is to have a single functioning parent board for the entire system. What we're planning to do, should we prevail in the auction, is we'll set up a couple of subsidiary corporations to Concord Hospital, and they will each hold the assets of the two hospitals. But most of the responsibility, the governing responsibility, will sit at the parent level. And so the parent board will be that single governing board for this single central New Hampshire healthcare system. And I guess as such, we've always sought representation from the geographies we serve. And we would do that in this situation. Having a larger service area would require us to reach out to connect with members who could be trustees on our parent board that hail from the new geographies that include the Three Rivers region and the Lakes region.
Thank you, Bob. So will Concord Hospital help sustain LRGHealthcare throughout the bankruptcy process? What happens if they cannot sustain until this process is complete?
Well, what we understand is LRGH has done extensive cash flow analysis. They've got third-party financial advisors advising them, and they've looked at their situation, their expenses, their cash flow, their CARES Act funding, their state funding, and they put that all into an analysis to see, can they manage their cash to get to a closing, which includes getting through the bankruptcy process and subsequent to that, the regulatory approval processes. And they believe that indeed they do have the cash flow to get to a closing in a reasonable time frame. And so I suggested that time frame was 6 months. If it got much beyond that, perhaps there'd be some concerns, but I believe they feel confident in their ability to get to a closing in that time frame. The question is, would we help out if they couldn't? And I guess we would take that as it comes. Scott, anything you'd add to that?
No, I think that is the answer, Bob. We're not being asked to carry them through this process. We believe if the process goes as we expect in terms of the time frame, they do have the cash to get there. If we are 5-6 months out and there's a need, as Bob said, we will take it as it comes, but we certainly can't predetermine that at this point.
Thanks, Scott.
Next question is, does all the debt for LRG Healthcare go away in a bankruptcy? What about pension underfunding? How much is that?
Yeah, so, and again, I'm going to turn to Scott, but we'll try to simplify what could be viewed as more complex financial issues. You certainly have the debt, but then you have liabilities. And the pension liability is a very, very important one. And in our purchase agreement, we believe the right thing to happen here is for Concord to assume their pension, including the underfunded portion of that pension. And so we have a plan to assume the pension, even though it's not fully funded. But Scott, maybe you can comment on both debt and liabilities in general, because Chapter 11 provides for a significant reset of all of that.
Sure. So the debt's an easy question. The debt would be extinguished through bankruptcy. It's one of the main reasons to go to bankruptcy, to essentially deal with excessive debt. So that will go away. As Bob said, we really looked at the pension plan, and it does have an underfunded liability of approximately $13 million. And we felt that it was important that we take on that pension plan. And when we look at the plan, there is cash in the plan, but pension plan accounting is pretty arcane. And the reason is it is underfunded, partly due to some investment returns lower than anticipated over the last 2 years. And then also the fact that Lakes had taken a cash holiday in terms of funding the plan and had been using prepaid funding to essentially afford the plan. So when we look at it, we think the plan is fundamentally sound. It is underfunded according to the rules, but that doesn't mean it has zero money in it. It just means that there's been cash holidays and investment returns lagging guarantees in the plan. So it's something that we would take on and really look to firm up investment returns and really look at sort of the cash funding holidays and bringing those to an end and putting some additional cash in the plan. But that was an important aspect for us in this bid.
Thanks, Scott. So the story is the debt it gets extinguished. The liabilities mostly are dealt with through the bankruptcy process. So we obviously said we would take on the pension, so that's an important liability that we assume for the employees of LRGH. But most of the other liabilities are dealt with as the bankruptcy process proceeds. And so on the other side, not much liability travels. Now, there is one exception to that related to Medicare billing. And we've done analysis to feel comfortable enough that that isn't an unreasonable responsibility to take on. Thank you.
Thank you, Bob. Can you assure Granite Staters that costs of healthcare won't increase as a result of the merger?
Well, we actually look at the merger as an opportunity to bring both of our healthcare systems together and pursue the synergies that are there. For instance, we've talked about IT in a couple of times, but we frankly believe we can cut their IT costs in half and provide a better information system. So it's moves like that that focus us on managing costs and keeping costs in check. This is motivated primarily by mission to ensure people in the Lakes and Three Rivers regions do not lose local health care. We believe, as Concord Hospital has demonstrated to ourselves, we can do that in a sustainable manner. And that means lowering costs to ensure sustainability. So there's a lot behind that statement, but the way we would build this system is to ensure we're tapping into all efficiencies, economies of scale, and synergies necessary to do just that. Scott, how else you want to jump in on that too?
The only thing I would add, Bob, is just the fact that we know healthcare is too expensive in America. It's too expensive in New Hampshire. And as Bob talked about a single system, we're going to do everything we can to keep costs the same and actually work to lower costs. So there are really no decisions we're queuing up that we think would increase costs. It's a problem that we're all tasked with tackling, and we take it serious, and that's our plan.
Thanks, Scott.
Next question. How concerned are you about the potential for antitrust complaints from other healthcare providers in the state?
Yeah, I guess that's a little bit of a speculation too. The interesting thing about antitrust is when you have a company that's essentially failed, there's a thing called failure of firm. And when it fails, then, you have to find a solution. We happen to have teed up the solution as Concord Hospital, working together to ensure local health care. So I'm not too concerned about that, but we'll have to see what people want to register in or weigh in on this process. I personally don't think that antitrust will be a big concern, but some others may register the concern. I don't know.
Okay, thank you, Bob. Over the last few years, the Lakes region has suffered a tremendous loss of internal medicine providers. Will Concord Hospital consider bringing more internal medicine into the Lakes region?
Yeah, great question. And I'm gonna just say something, but tee up Dr. Gibb to jump in. When we look at the clinical scope, there's a lot of things we'll take under consideration as we think about how to build it out and reboot it. But one of the things that stands out to all of us is the need for an investment in primary care. And it is just that, an investment. And so without doing a great deal of analysis, we know that should we prevail, we're going to be making investments in primary care. And I know internal medicine is an important piece. So Matt, you want to jump in?
Yeah, thank you, Bob. I think that's a really important call out. We do know that primary care in general in the Lakes region has suffered over the last several years, and then loss of internal medicine physicians has definitely been prominent. We have a cardiology practice in the Lakes region that's been there for some years, so we have a direct line of sight to the gaps in primary care providers in the local community through our own physicians' experiences. So I would just say that we know primary care needs investment. We're already planning for what that would look like, and that will definitely be front and center of our clinical scope conversation.
Thank you, Matt.
Thank you. You mentioned the possibility of a physical auction if there are other bidders. What exactly does that mean? And does it add risk?
So what it actually means is, and there's a lot of detail to this, so I won't take you down through all the detail, but this particular process is a Chapter 11 bankruptcy. There's two types of Chapter 11 bankruptcies. One's a planned reorganization. The other is called a 363 auction. We're going down the 363 auction path. So anyone that would bid would have access to our purchase agreement so they could see the scope of what's been agreed to. and they would have to essentially better our bid. And so they would have to not just the price, but they would have to have a response to the assumption of the pension plan, for instance, and a response to other elements that are perhaps non-monetary in our agreement. And so any bidder would have to improve the bid, and then it would go to a physical auction, which is just as it sounds, an auction process where if there are multiple interested parties, there would be multiple bidders in a live auction. And that's how that plays out. So we'll have to see if indeed there are bidders that lead us to a physical live auction.
Thank you, Bob. Do you envision the closure of any services in Concord?
Yeah. Oh, in Concord? No is the answer to that. We're always asking ourselves as a regional health system, on the edges of who we are, what we need to be developing. And there's plenty of examples that Dr. Gibb could tell us about in terms of evolving our advanced care. And perhaps that's something you might want to share a little bit about. But in terms of closures, we're not anticipating any closures of services in Concord whatsoever, but probably continued investment in the advanced care services we provide to the region. Matt, anything you'd say to join in on that?
Bob, no, I completely agree. Certainly no planned scale backs or closures of services we currently provide. I'd offer a couple of examples of how Concord has actually added services. An important one is becoming a level 2 trauma center. So we are able to, serve in a more advanced way for trauma care in the region versus just in the local community in Concord. In the cardiovascular arena, we've added services in the last couple of years like catheter-based aortic valve replacement. And you can go through all of our clinical offerings and see how we've advanced in a planned way pretty much for our whole existence. And I think we would continue to do that with an emphasis on providing healthcare locally in the Lakes region and make that as appropriate as it could be, but also provide maybe a better connection to some of the more advanced services that we have here in Concord.
Yeah, that's an important call out, Matt. I think the access question, can we improve access? And we're certainly doing a lot of that work here locally. But regionally, our focus will be on improving access as two separate systems. Having advanced care referrals, we want to make sure that as a single system, we can do that more smoothly. And so access will be an important piece for us.
Next question would be, what do you envision the changes to be with the medical staff?
Yeah, I'd ask Matt to jump in on that.
The current environment is for both Franklin and Laconia is what's called an integrated medical staff. So they have a process of governing the medical staff that includes both facilities. So things like privileging, credentialing, and the like. We would maintain that as a integrated medical staff of those two facilities. We don't have an immediate plan to integrate it from a governance perspective with the medical staff of Concord Hospital, but we would provide a number of support services through the medical staff office that would create a single approach to, let's say, if you're a new physician in our system, how would we approach referencing, credentialing, privileging? So I think that in the short term, that model will serve us very well, and to be determined in the future, whether we might pursue a fully integrated medical staff, but that wouldn't be a first step.
Thank you, Matt.
Thank you. Do you plan on making improvements to the outlying ambulatory services in the Lakes region? If so, would that include updating equipment and providing advanced training for staff?
So I think as we plan out the scope of what we're going to do, it will be all about improvements, and we'll need to ensure we have appropriate equipment and appropriate training. So yes is the answer to that in general. Matt, you want to make a comment?
No, I agree, Bob. You know, we're certainly aware of individual situations where equipment does need replacing or updating. And I think the education of the healthcare workforce perhaps does suffer when a hospital is under financial strain. So we have to look at all of that, but our goal would be to, you know, use the same approach that we do here in Concord. We want to be able to provide the same level of support to the healthcare staff, and you know, outlying was mentioned in the question, so I think that also includes the extension in the towns around Laconia and Franklin, and I'm sure, you know, emergency medical services are maybe a part of that question as well. So that's all on our radar.
Thanks, Matt.
How can Concord Hospital afford to purchase the assets of LRG Healthcare?
Yeah, well, and I'm going to ask Scott to come in on this one, but I have to tell you that, you know, as we sit here today, Concord Hospital is positioned quite well. And that's not because of something that was done this year, last year, or 5 years ago. It's from a disciplined approach to managing our assets, our expenses, our growth in a responsible manner for over 3 decades. As a result, from a credit agency perspective, those that rate us, we have the highest rating in New Hampshire, at least 2 notches over the next highest. And so we've managed ourselves very well for decades. And as such, we can afford to make this investment, and it will not affect us in a significant way, or it won't affect our financial strength. And we don't expect it will affect our credit rating either. So we feel very confident that we can make this investment based on the strength of how the organization has been run for decades. Scott, you want to jump in?
Sure, Bob. I guess what I'd add to that, as Bob mentioned, we've performed well over many years, decades, and you know, this acquisition of assets, as Bob mentioned, it's a mission decision. And when we look at it, it's really, it aligns with our mission. It's to serve the population of the region. But when we do turn it and look at the finance aspect of it, it's really an investment in capital. It's an investment in assets, and frankly, ultimately an investment in people that we believe will be a sustainable healthcare system. So when we look at the numbers, how we can afford it is we look at it as a long-term investment of a contiguous community we serve, and we're confident in the future financial return. So the money has come from decades of solid performance in Concord, but it really is essentially going to pay itself back over a period of time.
Yeah, and that's an important point to perhaps emphasize. Again, we wouldn't be here if we didn't believe that we could create a sustainable system in the Three Rivers and Lakes regions. We're here because we believe we can. And that statement means that Concord Hospital is not in a position to perpetually fund an underperforming asset. We believe, with the analysis that's been done, the removal of debt, the proper capitalization, lowering IT costs, seeking out the synergies and economies of scale, that indeed the system can be run with a modest margin. We live in New Hampshire. Margins are not extremely high. A modest margin, a sustainable margin. So after we accomplish a purchase, should we prevail, then we believe we can set the system up to run and achieve sustainability, financial sustainability.
Thank you, Bob. I've heard Bob talk about Central New Hampshire Healthcare. Do you plan to change the name of Concord Hospital?
Yeah, thank you, Lori. This question's come up a number of times, and I had to be sort of my first reaction to that is what I said in the beginning. This has been a mission conversation. We are making sure the healthcare system for folks that live in the region is not compromised. And that's been our focus from the top down. And so there's lots of other questions that come, but we haven't given any thought to changing the name. In fact, we believe that the Concord Hospital brand is extremely strong. And what we want to do in the near term is extend the strength of the Concord Hospital brand to the Three Rivers and Lakes regions. But we have not given any thought to changing the name at this point. Instead, we'll leverage the strength of the brand we have.
Okay. Okay, so this is a technical question about bankruptcy. In bankruptcy, will LRG Healthcare be able to start fresh going forward and begin demonstrating a more positive financial operation without the support of an outside partner?
So, and Scott, you'll have to help me a little bit with this, but when LRG Healthcare goes bankrupt, the company, LRG Healthcare, is no longer going to be a healthcare provider. It's going to be, if we prevail in the auction, it will be Concord Hospital, and we will have Concord Hospital Laconia and Concord Hospital Franklin. And so the system will be run as a singular health system in central New Hampshire. And we believe, as I said before, that it can be run in a financially sustainable manner to continue to deliver local healthcare. Scott, you want to add to that?
Yes, what I'd add is Lakes has filed for bankruptcy. At the same time, they have assigned sort of an asset purchase agreement with Concord Hospital as a bidder. So they've already made the decision. If we prevail, they will be part of us. If we don't prevail, if another bidder comes in, they'll be part of them. So there isn't the opportunity for Lakes Region to file for bankruptcy and then come out and run themselves again. They will be part of a different system. We believe and hope it'll be us. And even beyond that, solving the debt problem was the biggest problem they had, but we talked earlier about their IT issues and other issues. New Hampshire is a small state in general, and the community LRGH and Franklin serves is a small community, and it's not growing. So the challenges would remain. Eliminating debt and a fresh start would be great, but the other challenges of running a health system would remain. So the reality is, for Lakes, they are joining a system, and again, we believe and hope it'll be us, and that'll provide sustainable, long-term ability to provide care in the community.
Thanks, Scott.
Thank you, Scott. Do you envision any other mergers or acquisitions in the Lakes region of other healthcare providers?
Yeah, when you do a transaction like this that we're hopeful we can accomplish, people always ask that question, to what ends or where are you going? We're not about mergers and acquisitions. We never have been, we never will be. This was a mission-directed process to a provider that resides in a contiguous geography north of us who is challenged. And so that's why we're stepping up in the way we're stepping up to commit to purchase the assets and run the system sustainably for the long term. But we're not out. There's no other transactions that we're working on. We're not out in the business of pursuing acquisitions, but you never say never. And to the extent that some kind of acquisition or merger would make sense for the way it would accrete or positively affect the way we deliver care in communities, it should be considered. But at this time, we have no other transactions that we're looking at. We're doing this for a mission reason, and we believe we can do it very successfully.
Thank you, Bob. Next question is, would Concord Hospital have the goal to bring back certain services which have been lost at LRG Healthcare? such as full mammogram, excuse me, with necessary follow-up, vascular services, and OBGYN. In other words, is there recognition that it creates a stress on LRG healthcare patients to send them to Concord for a vast majority of services?
Yeah, so that's a very specific question that I'd ask Dr. Gibb to opine on. But remember, we're going to need to configure this in a way that we can keep costs low and we manage the system and also serve the patients and make sure the customer service and access is appropriate. So, Matt, you want to run with that?
Sure, Bob. So yes, a couple things to consider here. There have been losses of services, as the question states, and we would look at what we could do to provide local services, at high quality and with, if possible, not the need to go back and forth between Concord. The three that are mentioned, I'll opine on a little bit. Full mammogram and necessary follow-up services are important, and there has been a loss in that full service recently. Personally, I think there's an opportunity to rebuild that, and that would be something we'd look carefully at. Vascular services has two pieces to it. One is the ambulatory care of the vascular disease patient, and the other is operative or procedural care. So we do have an outreach clinic for vascular services currently at LRGH, and we would actually look to try to amplify the opportunities there in the ambulatory space. Whether there would be a resumption of any surgical or procedural care, I think, is an open-ended question, and I personally would believe less likely. Deliveries are also an issue that reflects the birth rates in New Hampshire and the local community, and I think that decision to discontinue deliveries was generally related to declining birth rates and declining deliveries, and also the cost to maintain the entire spectrum of services that's needed to support a labor deck. We have, when that decision was made by LRGH, we have provided prenatal care with the Concord Hospital obstetrician in the region, Dr. Stevenson, and we want to provide a prenatal opportunity that connects well for all the women in a pregnancy locally. But I think, and I punt it back to Bob, I think it's not likely we would resume delivery services at LRGH.
Yeah, Matt, I would agree with that. The numbers made it very challenging to be able to do that. And so I wouldn't envision that would change.
Thank you, Bob and Matt. The governor last week spoke positively about this process and Concord Hospital stepping forward. Have you received any other feedback from the community, from your staff, and from the medical staff?
Yes, we've received a great deal of feedback where the bankruptcy announcement was made a week ago Monday, and we've held a number of virtual town halls with our staff and one with the medical staff, and we continue to take in feedback every day. I'd have to tell you that most of the feedback has been very positive, and folks have thought that very much mission-like, that we can't stand by and let a system fail next door to us. We don't have everything we need at Concord to be able to just let that collapse happen, and nor would that be in the interest of the community or the communities. So the reaction has generally been positive. People are concerned about the costs. And so that, as it has been tonight, those questions have been asked about, can we run it sustainably? and what does bankruptcy allow us to do in terms of eliminating debt and eliminating liabilities and starting fresh and running it in a sustainable fashion. So we've had a lot of conversation like that. But all in all, the feedback we've received, I would say, is very positive. I'd ask my colleagues if you're all taking feedback in, Scott and Matt and Lisa. What would you say?
I would say overwhelmingly it's been positive, Bob, from all sources.
Thanks, Scott.
I would agree. People have been very supportive in the behavioral health community, knowing that it's an opportunity to strengthen the system.
Thanks, Lisa.
Yeah, completely agree, Bob. The feedback from our physicians and patients in our community has been positive.
Thanks.
Okay, thank you all. Next question has to do with PCP capacity. And the question is, it's already difficult to get in to see a primary care provider. How will this change things for Concord and for the Lakes region?
Yeah, and I think this circles back to what Matt noted earlier and I commented on, which is without doing a great deal of analysis, we see the importance of making investments in primary care. And we're thinking about that almost in advance of everything else. We know that we need to stabilize and provide adequate primary care with the right geographic dispersion and service and access. So we've been thinking a great deal about the need for those investments in the broader region. Matt?
Yeah, again, agree totally. We at Concord Hospital have been focusing quite a bit on our own access for primary care, and some examples of the work that we're doing, and now all of our primary care practices are open to new patients. We have put a focus on improved processes for new patients coming into our primary care environment, and a number of other efficiency and practice operation improvements around phones and flow and the like. I think this is all scalable to the Lakes region. In addition to that, we know there will be a need for additional providers, physicians, and perhaps advanced practice providers in the primary care specialties in the Lakes region. So we've begun some thought about how we could maybe be able to facilitate that recruitment if we were to come together as a larger health system.
Thank you. For our audience, I'd like to mention that we are currently at 6:52 and we're committed to winding this up at 7. So if you have any other questions that you haven't submitted yet, please do so. Another question is the medical office building adjacent to the hospital, and I believe this refers to LRGH, part of the assets being auctioned?
Well, I'm not sure what medical office building that refers to. Scott, you want to?
Sure. The short answer is yes. The medical office building that's attached to the hospital through the lobby is an asset of LRGHealthcare, and our offer was to essentially purchase all of the assets of LRGHealthcare, so that medical office building would be included.
Thank you.
Very specific question. Okay, I think that's what we have then for questions. I don't see any others offered up here. So folks, would you like to add anything that hasn't been asked that you think is important for folks to know? I'll leave it to you four to kind of wind things up here.
I would just again thank everyone for participating tonight. Recognize this is a virtual town hall, but here in Concord, we have lots of conversations every day, both within the organization and within the community. And we look forward to taking any additional feedback or comments or questions, really 24/7, 365. That's who our team, that's what we do. That's our team. So don't view this as the only opportunity to ask questions. We're always out and about, but mostly I just wanted to thank you for connecting with us. We appreciate the opportunity to field questions and take in input. So thank you so much.
Lisa, did you have something?
Very good. Thank you for the opportunity. Look forward to hearing more.
Matt?
No, I'd also thank everyone for participating and the great questions. And we are enthusiastic about, as Bob said, a mission opportunity to stabilize and extend healthcare in the communities in the Lakes region.
Scott?
Just echo what my colleague said. We appreciate everybody participating, and actually the level of engagement is encouraging. So we look forward to this journey.
Thank you all for being with us this evening. Thank you to our audience this evening. We will continue to provide information about this process as it progresses. Look to Concord Hospital's website and Concord Hospital's social media, and you will find that information available to you. If you have a question, please do not hesitate to pose the question, and you can pose it either on social media or you can contact the Public Affairs Office at Concord Hospital. Folks, I want to thank you all from our panelists for your participation and for the time that you've spent in this process. Looking forward to hearing more. With that, I'll wish you all a very good evening. Thank you.
Thank you.
Good night.
Good night.